This is Shannon DeCoyer. Welcome to my YouTube presentation on the delivery of healthcare in correctional facilities. A few attributes of the nurse in a correctional facility include professional autonomy and the ability to function independently. Nurses in a correctional setting possess the ability to initiate treatment using the provided NET tools or nurse encounter tools under the supervision of the facility medical director, provide advice or recommend a form of self-care, educate the patient about symptom management, or refer the inmate to a higher level of care if necessary. Effective communication is key. It is essential for the nurse to possess the ability to communicate effectively with both inmates and facility personnel. With the safety of all involved parties at the forefront, the delivery of timely and effective care is essential. Delivering healthcare to the incarcerated population requires an intake assessment upon the inmate's arrival at the facility. The intake assessment is conducted by the registered nurse in the booking office area. The entire assessment is witnessed by a corrections officer for the safety of the nurse and all involved parties. The nurse uses her professional judgment to determine the mental and physical needs of the inmate being screened. During an intake screening assessment, the nurse will decide if the inmate has a need requiring immediate attention or if a referral to in-house services is sufficient. If it is determined by the nurse that the inmate has a chronic condition requiring ongoing treatment that is not urgent, the nurse will obtain appropriate orders via telephone from the facility medical director to continue care until the provider appointment takes place. Additionally, identifying housing needs based on a significant health history is essential. The nurse is responsible for taking all information compiled during the intake assessment to make a decision on an appropriate housing unit assignment for the inmate. This includes notifying custody and appropriate personnel of any special accommodations that may be necessary to ensure the safety of the incoming inmate, housing mates, nurses, officers, and the overall integrity of the facility. Medication compliance and continuity of care. Research indicates that effective medication delivery and continuity of care to inmates within correctional facilities is essential for management of symptoms, slowing disease progression, and preventing relapse. The significance of correctional health care extends well beyond the walls of the facility, pouring over into the community. Daily, inmates are released from facilities to the streets of the community without appropriate amounts of medication to sustain them, potentially carrying life-threatening infectious diseases to the community. The health status of an inmate has an impact on any community the inmate chooses to relocate to following his or her release. This puts the public at the heart of the discussion of public policy in correctional health care. The perspective of the public provides a political force for corrections to move forward in evolving public policy on inmate health care. Medical professionals face many challenges in providing patient-centered care in correctional facilities. The greatest struggle in practicing nursing in a correctional facility is the development of a care team, including members of the inmate's life from outside of the facility. Coordination of care can be arranged for visits with outside providers, including orthopedics, maternal fetal medicine, and other various specialties. Involving family members to partake in healthcare decisions is extremely difficult while maintaining the integrity of the facility as well as the inmate's confidentiality. International frameworks, as well as a variety of national principles, recognize that inmates should be provided with healthcare attention that is aligned to healthcare provided to the general community. However, there is a variety of unique barriers to effective and efficacious administration of healthcare services on equivalent terms for the incarcerated population.